So should we talk about best options for treating hyperpigmentation?
That's a doozy. Let's do it.
It's like stretch marks. It's like the hardest
Yeah.
thing in aesthetics to tackle, right?
Yep.
And it changes year by year on how to go about it because it's difficult and it's a hard thing because it keeps happening, obviously, with advances in technology too.
No one is spared when it comes to hyperpigmentation. Fair skin, dark skin, young, old. We have many variations of hyperpigmentation, whether it's hormone related or sun related. So it's a lot.
Or laser induced, or
Right,
you
right.
know, which would be considered in like the trauma category.
Post-inflammatory, yeah.
Laura, do you want to start?
Sure. So I think it comes in two parts. So there's the at-home care, and then there's things you can do in the office. So with at-home care, I would say using some products that help with pigmentation, like hydroquinone products and retinoids. Just having a regular skincare routine that can help lighten the pigmentation and kind of work on those melanocytes in the skin. And then also following up with procedures in the office, like IPL lasers can really help with pigmentation depending on the type of pigmentation and your skin type. CO2 laser can help. Chemical peels can help. So all of these things combined can really help tackle it. But yes, it's super tough to treat, stubborn, especially patients that have melasma. That's even more difficult to treat because you're kind of limited on the lasers that you can use. But I would say starting there would be the best treatment plan.
Definitely. She pretty much covered everything that you can do, but treatments in the office can only do so much. You're never going to get rid of the brown spot or patch or freckle entirely. We can certainly do everything that we can within reason that's medically sound and safe to do, but ultimately you will probably just notice a lightening of your brown spots and not necessarily complete removal of those. And that's why it's important to do maintenance care, and that would include the at-home skincare, which includes, as Lord mentioned, the hydroquinone, retinoids. There's also kojic acid. We have formulated blends that we mix together that includes tranexamic acid, which is another big hot topic that's been in the world of derm for the last several years that we're really seeing good results with when it comes to lightening brown issues or pigmentation issues that can be used long term, because that's one of the issues with some of the older formulations like hydroquinone, where you can't be on it for too long. And so this development with TXA, tranexamic acid, allows a patient or person suffering from pigmentation issues to use something long term to help with their maintenance care at home.
Yeah, I mean, you guys covered everything exactly. So I guess my only thing to add would be to help patients understand where to reel it back. So to understand what they can do, what they've covered, what can be done, and then also what not to do. We were just talking yesterday about companies online, I won't mention names, but ones that'll give you, say, hydroquinone 12% or things like that, where you can actually get like a rebound hyperpigmentation from it. So people think, well, hydroquinone worked for me in the past, so maybe I'll try that and I'll just go like double or triple what I did before. And it's not necessarily good for you. And so sometimes you just have to be okay with what you got. If you got a third or 50% better, that might just be where you're at, whether it's melasma or just the brown spots. Some of the most sticky ones, the ones you hate the most, those may not go away, but we have to be okay with some of those things like wrinkles as well. And then also just maintenance. So like when you do an IPL or even a fractionated laser, like a cool peel or a DECA with us, a lot of things are going to go away. A lot of things are going to soften, and the things that do soften, we have to maintain that, because a lot of those things are going to want to come back. So when people say, well, hydroquinone didn't work for me, or a hydroquinone tranexamic or compounded like we do with other things in it, like you guys were saying, it didn't work. I ask often, why didn't it work? Well, it came back. Well, because it has to be suppressed long term. Those things are really, really stubborn and they want to come back. So to know that you have to kind of keep that calm is good to know. So,
and also, like, when you're addressing pigmentation issues, also consider improving the quality of the skin. So we're not just targeting a brown spot, we want to get rid of that, and that's all we're going to focus on. If you do an IPL treatment and it, yes, slightly lightens your brown spots, it's also going to help with the quality of the skin. It's going to help reduce your pores. It might help with redness. Cool peel, CO2 laser is going to help with texture. You're going to get improvement in the skin overall, so that even though the brown spot might not be gone, or it might only be mildly improved, you're going to see such an improvement in the skin overall that will be less problematic or more easily covered, or feel better going out without covering it, no makeup. And that's generally what we hear from patients. Not, oh great, my spots are gone. It's more, I feel more comfortable in my skin, whether that's going out without makeup or less makeup. And that's ultimately what the goal is, I think, for most women, is as we get older, we want to just have less maintenance. We want to just kind of get up and go and feel good with how we look.
Confidence,
yeah. Absolutely, from within.